So the tibia is on the medial side right there, and then the fibula is on the lateral side. So underneath the tibia and the fibula is the talus, and that is like underneath it, I guess. And then back in the back is like the heel would be called the calcaneus. And if you move forward, there's a bump called the navicular tubercle on the medial side. So I'm feeling that right there. So the home base bump allows us to find the first metatarsal and the first cuneiform. So I'm pointing to the first metatarsal, feeling it up, and then that's on the big toe, and then I find the first cuneiform. So here's the second metatarsal and the second cuneiform, and then the third metatarsal and the third cuneiform, the fourth metatarsal and the fifth metatarsal, and then in between is the cuboid up there. First phalange, proximal, distal. Second, proximal, intermediate, distal. Third toe, proximal, intermediate, distal. Fourth toe, proximate, intermediate, distal. Proximal, intermediate, and distal. So that's the tibia and the medial malleolus, and then over to the lateral malleolus, and then wiggle her foot up and down, but then we'll see the talocrural joint, and that is what the talocrural joint does. So the joint that's on this medial side, below the talus and to the calcaneus, is the subtalar joint, and we want to wiggle that foot from side to side. So I'm going to ask her to plantar flex her foot, so push it towards the ground, and then you see the little bump that pops out, and that's called the dome of the talus. So in the back, by the Achilles tendon, it's called the calcaneal tuberosity. There's like a bump. And then roll the foot on the lateral side to find the medial tubercle of the calcaneus. And deep inside, we can feel a little ledge called the sustentaculum tali, and that's where the muscles are going to be protected, and there's also a nerve and an artery. So continuing to make our way forward, there's a bump in the middle of the arch, and that is called the navicular tubercle. And down underneath the first big toe, we can feel the two pebbles called sesamoid bones. And there's a medial one and called the tibial sesamoid, and there's a lateral one called the fibular sesamoid. Head of fifth metatarsal, tail of fifth metatarsal, and lateral malleolus. So underneath the lateral malleolus is the anterior talofibular ligament, and then from the bottom of the fibula towards the calcaneus is the calcaneal fibular ligament, and going from the backside is the posterior talofibular ligament. With two fingers, go above the lateral malleolus, and that's where the tib-fib ligaments are. One in the front is the anterior tib-fib, and on the backside is the posterior tib-fib. By the medial malleolus, and feeling the deltoid ligament in this space, and the delta is the shape of a triangle. The last ligament is up and under the navicular, and it's called the plantar calcaneal navicular spring ligament. Medial longitudinal arch. Metatarsal arch. Transverse arch. Lateral longitudinal arch. Notice how much flatter it is. The plantar fascia starts as the medial tubercle of the calcaneus, and like a giant fan, fans out to the metatarsal heads. But it's not a ligament, it's like tough connective tissue that helps your arch stay there and acts as a spring to protect the rest of your foot.